I'm Dr. Basila Ameer, consultant breast surgeon at KMC Mangalore. Self-breast examination is a very important screening tool whereby the patient can examine themselves for the early signs and symptoms of breast cancer. It is done in the menstrual age after about 7 to 10 days of the menstrual cycle, and in the post-menopausal age, it can be done on any date selected by the patient in the calendar month. It is done by keeping your fingers flat against the breast and just examine the entire breast all over. Considering the breast like a clock, run your fingers from 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock and so forth. You will use your right hand for your left breast and your left hand for your right breast. You will not use pinching movements over the breast because that would make glandular tissue also appear like a breast lump. When you keep your fingers flat against the breast wall, if you feel anything which is a painless lump which might feel like your knuckle, especially if it is hard and irregular, you will go to the doctor immediately. In the end, you will just press your nipple very lightly to check for any bloodstained nipple discharge. This completes your self-breast examination.